Dr. Ken Landau. Thanks for watching. Let's talk about Nuedexta. Nuedexta is a drug that combines two ingredients. It combines dextromethorphan and quinidine. It was approved in 2010 by the Food and Drug Administration to treat PBA. That stands for Pseudobulbar Affect, present in Lou Gehrig's disease, or ALS, or amyotrophic lateral sclerosis, and in multiple sclerosis. It's important to realize that it's not been shown to be safe and effective in other types of emotional lability that you would find, for instance, in Alzheimer's disease and other types of dementia. Now, the dextromethorphan is a drug principally used as a cough suppressant. That's Robitussin and it's Dayquil, but it also works to prevent glutamate from activating certain nerve cells via the NMDA receptor. It works in other ways in the brain, too, that we really haven't characterized yet. But interestingly, dextromethorphan is a structural analog. In other words, it looks kind of similar to the opioids, but it doesn't work on the opioid receptor. But in some people who have abuse potential, well, this drug probably isn't for them. Now, it's rapidly metabolized in the liver by an enzyme known as 2D6. Remember that. We'll talk about that in a minute. Quinidine is traditionally used as an anti-arrhythmic drug, but in Nuedexta, it's only present in about 1 to 3% of the concentration used in cardiology. So in other words, it's used at about 20 milligrams a day for Nuedexta. On the other hand, in cardiology, it's used somewhere between 600 milligrams a day and 1,200 milligrams a day. Now, quinidine has no effect on the PBA by itself, but what it does, it inhibits that enzyme we talked about a moment ago, the 2D6, and that enzyme degrades the dextromethorphan, but if you put some quinidine there, it boosts the amount of dextromethorphan in the blood by about 20-fold, even though it's just a low dose. Now, PBA is a condition that once upon a time was known as IEED. That's the involuntary emotional expression disorder. Pathologic laughing or crying is another term for it, or emotional lability, or labile affect, or emotional incontinence. It was originally described, interestingly enough, by Charles Darwin over 130 years ago. And people who have this have involuntary episodes of laughing or crying, and they have this in certain neurologic conditions. It occurs episodically. They have exaggerated moods that don't seem to match how the person really feels. It's a specific condition, and it's distinct from other kinds of emotional lability. Here they have outbursts that last for a few seconds, maybe to a few minutes, several times a day. It can occur with severe, persistent, unremitting episodes. That's pretty rare. And it can come on like a seizure. It's unpredictable, leads to embarrassment and anxiety and depression for both the patients and for the caretakers. According to the company, there are probably around 2 million people who suffer from this disorder, with another 7 million having neurologic conditions that may predispose to it. And they think that overall, maybe somewhere between 18 and 20 million people may have the potential to develop this. On the other hand, the Mayo Clinic says, hey, come on. There are at most 200,000 people around with it, and it could be secondary to a lot of neurologic conditions. Of course, ALS and multiple sclerosis, but also to stroke and Alzheimer's disease and traumatic brain injury and Parkinson's disease. Well, we also find emotional lability in a variety of other conditions for which Nuedexta is not appropriate. It could be present in bipolar disorder or schizophrenia or autism or dementia or childhood irritability. Actually, the CEO of Avenar Pharmaceuticals, he describes Nuedexta as a pipeline in a pill. In other words, he thinks that it could be used for almost all sorts of conditions. You take Nuedexta 1 a day for the first week, and then you increase the dose to about 2 a day. Now, interestingly, there are some side effects. So probably 1 out of 8 people who takes this drug are going to have diarrhea. That's not very good. And probably about 1 in 10 people who take the drug are going to be dizzy. About 1 in 20 are going to have cough or vomiting. Some are going to have weakness or swelling of the feet and ankles. Some people are going to develop abdominal pain. And, of course, especially with the quinidine, there are some precautions. Precautions especially if you have something wrong with your heart, left ventricular hyperplasia or dysfunction of your left heart, or maybe you have an increased risk of the Serotonin Syndrome, and then when you take these drugs and combine them perhaps with an SSRI, Prozac, or Zoloft, or Lexapro, or a tricyclic antidepressant, you might develop the Serotonin Syndrome. Serotonin Syndrome with some mood changes and hypertension and some restlessness. The body temperature goes up, you become very sweaty, you can shiver, you can have a tremor, develop some lightheadedness and some chills and nausea and vomiting. Your reflexes are exaggerated. And with quinidine, you've got to be careful, especially if you have low potassium, low magnesium, or if you have a slow heart rate. And you shouldn't take the drug, especially the quinidine component. Of course, if you have heart block, or if you've taken an MAO inhibitor within a period of the past 2 weeks, or you have heart failure, long QT syndrome, or you have anything wrong with your heart, or you have myasthenia gravis, and if you've previously taken quinidine and it's caused either a low platelet or hepatitis or bone marrow suppression or a lupus-like syndrome, obviously you shouldn't take it. And because the quinidine is going to affect that drug metabolizing enzyme, the 2D6, that happens to be in the liver, well, it can cause problems if you happen to be taking other drugs that are going to be metabolized by the same enzyme. So if you're taking the clarithromycin or erythromycin or heart medicines like diltiazem or verapamil or even grapefruit juice or some AIDS drugs, or maybe you're taking an SSRI or a tricyclic antidepressant, you've got to be very careful. And since this affects a drug metabolizing enzyme, it probably is going to make codeine and hydrocodone not very effective if you happen to be taking them too. Well, Avanar funded a lot of research on this particular drug over a period of several years, and what they found was that in people who have the PBA, they did a study, and they evaluated some people who took 20 milligrams of the dextromethorphan versus, and 10 milligrams of the quinidine, versus a placebo. And actually, when they were followed over a period of time, it was found that the people on Nuedexta, the number of episodes fell by about 57%. The fall in the number of episodes taking the placebo was 67%. That's right. So it seems like the placebo might have worked a little better than the drug. Now, if you look at the total number of episodes, the total number of episode reduction was more in the drug group, but the percentage looked more in the placebo group. Now, the package says that the number of episodes per visit at 12 weeks going to fall in the Nuedexta group by 4, going to fall in the placebo group by 3. And if you look at the change in the Center for Neurologic Studies of Liability, they're going to be in the placebo group 6 fewer, in the Nuedexta group only 8 fewer. Well, in 2014 they began a drug awareness campaign. They retired that campaign in December of 2016. You remember that one with Danny Glover, where he was showing how he had the affect and he could go from normal to crying just very quickly. In the first quarter of 2017, they started advertising for the drug itself instead of just the promotional ads to bring you up to date on PBA. There's a questionnaire that they tell you on the commercial to go to. Go to this website, and you will see a questionnaire by the Center for Neurologic Study. That's from San Diego. Copyright by that drug company, the Avanar. They have 7 items. There are 4 items to assess laughter, 3 items to assess teariness. And almost everybody who takes that is going to have a score of at least 13. And the company says if you have a score of at least 13, you ought to go and talk to your doctor, because in over 80% of the time, it might be associated with PBA. But it's only been studied in the ALS patients and in the multiple sclerosis patients. Now, the company would like to think that maybe this drug might be eventually useful for agitation that's associated with Alzheimer's disease, or maybe major depression, or multiple sclerosis-related pain, or maybe some of the behavioral abnormalities that we see in dementia. Well, I think what you really have to realize is that the evidence that PBA is really significantly improved by taking the drug is kind of small. And we do have some evidence that taking much cheaper drugs, safer drugs, the selective serotonin reuptake inhibitors, Prozac, Zoloft, Paxil, Lexapro, or the tricyclic antidepressants, might work fairly well. On the other hand, the only FDA-approved drug specifically for the purpose of PBA is this particular drug. How much does it cost? Well, the cash price, little shy of $1,000 for a month's supply, but if you go to goodrx.com, you could get it with a coupon for maybe $800. Now, the prices increased significantly over the period of the past several years. Actually, the monthly price has increased by about $100 in that time period. Well, you have to realize that dextromethorphan or Robitussin, Dayquil, you could go and buy a bottle of that stuff at 30 to 60 milligrams per day. You could buy a bottle for $5 or $10, and the quinidine, you can go have a compounding pharmacy make that up for you. The total cost of the ingredient would be less than $1 a day, and as a matter of fact, indeed, there has been a congressional investigation regarding the pricing of the pill. They want to know how $1 or $2 worth of drug seems to be worth $600 for a prescription, or $700, or $800, or $900. They happened to evaluate them in 2011 when it was only $600, but it's gone up considerably since then. And interestingly, the same drug company, Avener, they make the Abreva. Now, you've heard of Abreva. It's distributed by a different drug company called GlaxoSmithKline. It's for herpes cold sores. This drug, 0.07 ounces, 7/100ths of an ounce, costs about $21. That means that this chemical costs about $300 an ounce. What is the chemical? Docosahexaenol. What is docosahexaenol? It's a bihenyl alcohol. That's just a saturated fatty acid. It's used as an emulsifier. It's an emollient. It's added as a thickener to cosmetics, and it's used as a nutritional supplement. FDA gave approval for this drug, the Abreva, in 2000. Subsequent studies have shown it's probably no different than a placebo. Doesn't seem to work very well. And as a matter of fact, they were advertising that it could cut the healing time in half, and then they had a class action suit that said, oh, no, it can't. Now they don't advertise that anymore. So my take on the medicine, it's much too expensive. There are unimpressive results of the medicine. You should try other options first. It's probably going to be widely prescribed because they're going to use a lot of it in nursing homes because it's approved for the purpose. And then we're going to have the indication creep, and that means it's going to be used for a lot of reasons not approved by the Food and Drug Administration. And in spite of that, it's going to cost a fortune for a drug. Doesn't seem very good to me. Anyway, that's my take on the matter. Thanks for watching. I'm Dr. Ken Landau.